Okay, so good afternoon to everyone. We were waiting some minutes so other people could connect, but we are going to start right now and hoping to others to connect in a few minutes. So welcome to everyone. Here's the webinar for the advisory services for Public Procurement of Innovation regarding the InnoHealth Support Project. So I will first of all welcome you all and present the agenda for today. So we will start with a quick summary of InnoHealth Support Project, just with the main information about the project and why we are here and when we are taking these advisory services. Then we will go in a bit more detail into the Tranche 2 advisory services, so the 3 services we are offering in this call, and that you can already see what it includes in the call documents. Afterwards, we will go through the application process, so we will give you the step-by-step to apply for this call and what you need and what you have to fill in. And afterwards, when we finish the information regarding Tranche 2 of these advisory services, we will do a quick recap of the advisory services of Tranche 1, that we will have the participation of Ulises Pisano, a partner of the InnoHealth Support Consortium. So he will briefly explain again the 3 services included in this tranche. So you, the ones that you are interested also in these initial steps of the Public Procurement of Innovation process can also apply to these services. And last but not least, we will have space for questions and answers at the end of this session. So as I was saying, for today we are 3 speakers. The first, myself, Diana Cortés. I am from Silo, which is a consultancy company based in Madrid, specialized in innovation procurement. And with me is Natalia Norambuena, senior consultant of Silo also, and part of the InnoHealth Support project team. And also Ulises Pisano from TIC Biomed, which is a partner of the InnoHealth Support Consortium and the partner in charge of the Tranche 1 advisory services. So he will introduce this part at the end of the webinar, as I mentioned before. Before starting, just some review of the housekeeping rules. So as you can see, this session is being recorded. So if you don't want your image or voice to be recorded, just please keep in mind you have to close your microphone and camera during the webinar. Also, we ask for everyone to keep the microphone turned off to avoid any background noises and not to disturb the speakers. Regarding the questions and the intervention of you, of the participants, just as I mentioned before, we will have a last section at the end of the webinar for the questions and answers. So you can wait to that section to launch your questions or type them in the chat box and we will address them at the end of the webinar. Okay, so as I was mentioning, we will start with a quick overview of the InnoHealth Support project. So InnoHealth Support is a EU-funded project aimed at enhancing innovation in the healthcare through the strategic use of public procurement. Its main goal is to provide healthcare ecosystems with training, consulting, and collaboration in procurement of innovation. To achieve this, we have 3 main pillars, and based on this, the services we are offering to the innovation ecosystem. So the first and second pillars are more aimed at public procurers, at healthcare providers, and it's the capacity building pillar and the advisory services pillar, which it has 2 tranches, as I mentioned before, and the reason why we are here today in this webinar. And the third pillar about the matchmaking of suppliers and investors, more based and aimed at supplier side, so for SMEs and startups, that we have also the information in our website, and we have webinars recorded regarding these services. So to go a bit more in detail regarding these pillars and the calls related to them, just a quick overview. So for the first pillar regarding the capacity building, very soon we will launch this call and announce the information and the process to register for this call. So stay tuned because we will be announcing during May the information, and the call will be open very soon. These services will be delivered in sessions from September 2025 until February 2026. In total, there will be 8 one-day sessions, and it's a combination between online and offline sessions. Regarding the second pillar, the advisory services, as I mentioned before, there are 2 tranches. So the first tranche is more aimed at organization with no knowledge or very little knowledge in innovation procurement. So for reviewing the first steps of the innovation procurement process, this call has been open since the end of last year until April of this year, but continues open for new requests of organizations. The second tranche, which is the tranche that we are addressing in this webinar especially, was open in April and will keep open until the 30th of May, of this year. So you have still quite a lot of time to apply for this call that we will explain now in more detail. In the delivery of this kind of services, so for tranche 1, we have the services delivering from April, May, finally, for 26 weeks. And then for the tranche 2, so for the advisory services we are going to explain now, we will start in September 2025 and also 26 weeks, so approximately until February 2026. For the third pillar of the matchmaking for the supplier side, in this case, the calls will have 3 cohorts. The first cohort has already been launched and closed on the 18th of April, and the selected organizations will be now contacted, and the services will start in May until October. Then we have 2 following cohorts, one in June and then of this year, and the next one, the third cohort and last cohort, will be in January 2026. And then you can see also the dates in the slide about the delivery of these kind of services of matchmaking. Okay, moving to the advisory services. So first of all, to give you some main information about these services. So the call will remain open, as I mentioned before, from April until the 30th of May. So you are still on time to register for this call. The target group of participants, we are looking for teams of 3 people or more of the same health or social care organization. In this case, for this kind of services, we are looking for organizations or teams with medium to high level of innovation maturity. So not so much for the initial steps, as this is addressed in tranche 1 that Ulises will then explain, but more advanced organizations, let's say. So we are going to review the services we are going to deliver are more for the following steps of the innovation procurement process. Also, you have in the slide the link to the call and all the information on how to apply, but we will share this presentation also so you can have the information and direct access to the link you see on the screen, and of course the documents you need to fill in. Regarding the 3 services we are offering in these advisory services of tranche 2, so the first service number 4 in this case, is the funding opportunities identification. So here what we offer is to help procurers to explore and match relevant EU, national or regional funding sources to support their innovation procurement plans. So as you know, it's very important to have this information in order to develop a PPI process. So it's good to have a clear idea of what are the opportunities for funding that they are available. The next services is service number 5. So in this case is the tender document preparation. Here we will give support in the drafting of clear, innovation-friendly tender documents and attract high-quality proposals while ensuring legal compliance. In this case, you know, the innovation procurement processes are very specific, so you have to balance a bit the innovation-friendly tender, but also with the compliance of the legal aspects. So it's a very important item also that we have to review and have clear when developing these kind of processes. And the last but not least is service number 6 about contract management support. So when the contract is already assigned and the project itself starts. So here we will give support with the the post-award contract execution with tools for monitoring performance, managing risk, and handling intellectual property rights in innovation procurement. So this was a quick overview about the three services. I will go more in detail now, but first I will like to highlight the most important benefits for the selected participants in this call, and of course in the others, but in this case, this call. So first of all, to highlight, this is a service that offers a personalized expert support. So you will receive tailored coaching from leading experts in healthcare innovation procurement, and it will be adapted to your organization's specific needs and maturity level. So we will now see how we are going to propose the methodology for the service, but this will be adapted to each participant. Also, as benefit, we wanted to highlight this, that you will strengthen the strategic capacity of your organization. So the ability to plan, finance, and manage innovation procurement processes with the use of practical tools and methodologies ready for implementation. So you will have the information and knowledge about all of this to develop PPI processes. Additionally, this will suppose an acceleration to real world impact. So this would be like a translation of innovation goals into actionable procurement practices that deliver better outcome for patient professionals and systems and the organization itself. And also important to highlight that this is fully funded by the European Commission, so you will have access to high-level technical assistance with no cost for your organization, thanks to the financial support under Horizon Europe program. Regarding the methodology of the service, that as I mentioned before, it will start in September of this year. So the timing we have for these services for tranche 2 will consist of 8 steps. I will go now through them in a bit more detail, and it will last up to 26 weeks in total, so approximately until February 2026. But as I mentioned before, these services will be adapted to organizations. So we will do the planning with you, and we will adapt to your availability and the scope that is agreed upon each organization. So the methodology is designed in a form that we have both joint and individual sessions. So we will combine these two with around 18 sessions in total per team or organization. And also you will have additional materials that for you to review and to have more information about the service you choose for this call. Each team will come with an assigned expert coach to guide them through all the phases. So you will be assigned one coach that will give you the support through all the individual sessions and also participate in the joint sessions I was mentioning before. So on the bottom side of the slide, you can see the steps we are going to follow, just going very quickly, and I'm going to explain it afterwards. So we will start with an onboarding of all the organization. Then we will appoint your coach or advisor for your service. We will do a maturity assessment of your organization. So we want to personalize as much as possible the service for you. So we have to assess at what point you are and what are your knowledge and the team participating in the service. Then we will go through a methodology overview, and we will start with the planning I was mentioning. So we will plan the specific sessions we are going to deliver for you in the framework of these services. And then we will start with the individual coaching sessions and also highlight the synergies you can identify among all the participants of the call. And last but not least, we will do a reporting evaluation and next steps to be followed. So we will do like a kind of final report of all the service and the next steps for your organization. Going a bit more into detail of this planning for the 8 steps, as we have a step 0. So as I mentioned, we will start in September 2025 with a collaborative kickoff. So we will have a joint session for all the participants and teams in the service, and we will explain a bit more the advisory services and the different services of the 3 I mentioned before. Then, well, first of all, I wanted to say that these dates are tentative, as we will adapt a bit to the teams that I was mentioning. So it's just a preliminary calendar that we will adjust with each of you, but we wanted to give you this information as a tentative calendar of what we are going to do in the following months. So once the kickoff is done, we will appoint the advisor for each team. So you will be presented to your coach, and he will introduce himself to the team and establish contact. Following this, we will do the maturity assessment individual consultation I was mentioning. So we want to evaluate your innovation procurement maturity and to set and to have more information about your organization and knowledge in innovation procurement. Following this, we will do a methodology overview group session where we will present the methodology and an approach to the program more in detail, because today is like a summary of what we are planning to offer and what the services consist of. Then we will do a planning individual consultation. So we will, here with the coach or your advisor, you will develop a tailored action plan during the approximately 2 sessions, but we will work on a planning for the following weeks and months to work with your team and with us. Afterwards, the execution of the individual support will go on. So we will have several sessions, individual sessions with your team. This will be based on the planning we set at the beginning, but also on demand. So we will see when the service starts, how much session do you need and how frequently. So this will be adapted to your needs. The next step will be the synergies. So we will have a collaborative exchange session. So we plan to do 2 exchange sessions, but we will see when the time arrives to present and identify the synergies among all the participants. So this will be a joint session. And the final step, as I was mentioning before, we will do a final report with you to include all the information shared during the services, the different sessions that we delivered, and also some important information for you to have as consultation, and also to include the conclusions of the services and next steps for your organizations. So going a bit more into detail of the different services, the first one was, as you remember, funding opportunities identification. So in these services, we will select up to 6 participants. So as you know, when you access the call, you have to select which services do you prefer. So in this case, we have six places available. In this service, participants will learn a clearer perspective on available funding opportunities and how to leverage them to support their procurement objectives. So these services, what we'll do is to provide tools and knowledge that can be applied directly to ongoing or future procurement initiatives. So don't think that you have to have already an initiative. Maybe you are thinking of an idea but don't know how to look for funding opportunities. So this service could help you to identify those opportunities. It will also enhance the capacity of public and private procurers to secure financial support for innovation-driven projects. So what is in this service for you? So you will gain knowledge on available funding opportunities, application process also, and best practices we have based on our experience, and also to have practical tools and expert guidance to successfully apply for and manage funding opportunities. Because as you know, it's not only about identifying these funding opportunities, but also to know how to apply for them and to do it properly. Moving to the next services, the tender document preparation. In this case, we have 3 participants selected for these services, 3 available spots. In this case, the content that we will go through in this service, it's about gaining practical knowledge and tools to enhance the quality of the tender document. So the objective here is to let you know how to make tenders more effective in attracting innovative solution and ensuring procurement success, so that you design a tender that it's not problematic or it's flexible, so that the innovation can occur. So what will you find in this kind of services? You will create a well-structured, flexible tenders that foster competition and innovation. As you know, and this is very important in this kind of innovation procurement processes because we have to be flexible, but also comply with the legal aspects. So it's a balance we have to work on and to design very well the tenders. We will also go through the encouragement of SMEs participation. So for this, we will go through and recommend how to reduce administrative burdens and focusing on functional requirements in the tender, so it's more attractive for SMEs. Also, we will learn how to manage IPR and risk effectively, ensuring fair commercialization opportunities for suppliers. So this is very important also and key aspects in the design of tenders. So we will go through it in the services. Moving to the third service is the management support for the contracts. In this case, we have 3 places available, so we will select 3 teams, our organization for these services. Here you will gain structured approach to contract management, so we will focus on reducing risk associated with the supplier performance, the technological advancements, and procurement execution. So this service is designed to be very practical and adaptable, ensuring that public and private procurers enhance contract outcomes while managing compliance with the EU procurement frameworks and legal aspects. So what will you find in these services? So you will learn how to manage contracts more effectively, reducing risk associated with the performance and technology changes, and the flexibility we mentioned it before. We will go through how the contract flexibility has to be implemented while maintaining alignment with innovation procurement goals. So we will go through the monitoring process and how to track all this to maintain the objectives of the tender and the project and the innovation project. And also we will navigate legal considerations around IPRs, ensuring fair innovation-driven agreement. So this is a quick overview of the 3 services I was mentioned before. You have all the details in the call documents, and if you have any doubts, of course, you can contact us to clarify any aspects. So now I'll give the floor to my colleague Natalia, who will introduce you a bit more the step-by-step of the application process.
Hi everyone. I will take part to help you go through this the applying process of the second tranche of the advisory services. So let's begin with the key information. Applications are open now, and the deadline to apply is the 30th of May, as we mentioned before, 2 p.m. Central European Time. So please be sure to submit all the required documentation before this date. You have other advisory services designed to support healthcare providers through the innovation procurement lifecycle. This includes identifying funding opportunities, preparing tender documents, and managing contracts, as Diana says. So the aim is to provide you with a comprehensive support to streamline to your procurement strategies. Who can apply? So the beneficiaries for this call is open exclusively to healthcare providers. We are particularly looking for multidisciplinary teams composed at least of 3 professionals from the same organization. These teams should be capable of complementing each other's expertise and stepping in when needed to ensure continuity of the work. So as I said, who can apply? We are looking for public and private hospitals and nursing homes and rehabilitation centers, public health department, and other healthcare providers. So as I said, we need to a group of 3 or more professionals. So for the documents you will need to review, the call documents are 2. To apply, follow these 3 steps. First, read the guidelines for applicants that are available on the InnoH support website. Then you have to complete the administrative and proposal form that is uploaded in the website too. And third, you need to access the online platform to submit your application. Please be sure to review first all the documents, and if you have any doubt or the documentation of the online platform, please, you can contact us and we can help you. So as I said, well, you have to read, ask, and fill in of the documentation submit to the user review platform. For the evaluation proposals, we have an evaluation process of 5 steps. You have the eligibility check, then remote evaluation of with the experts, then the preliminary ranking and communication of result selection. Then you have a time to appeal the procedures where you can communicate with us through our mail to appeal the procedures and ask us for reconsideration, and then the final ranking and publication of the results. So the evaluation committee is a selection of experts that will be appointed to evaluate the applications and comprising experts from the project partners. How is the evaluation criteria? The proposal will be evaluated based on 3 main criteria: feasibility and team commitment. Each represented 40% of the total score, while the willingness to adopt the innovation solutions account for the 20%. So we highly encourage applicants to review the guidelines carefully to align the proposal with these criteria. The evaluation proposals, here you have some dates for each of the steps. These are, let's be aware that these dates could change through our project needs. So for the call, we are going to close the call the 30th of May. Then the eligibility check will be from June 9 to June 30. Then you have the remote evaluation that is from June 16 to June 30, and the 1st of July we'll have the final ranking publication. So thank you very much. And now we have Ulises Pisano explaining you the advisory services, the tranche 1 section. Thank you.
Hello, everyone, and thank you for joining. I'm going to present the first 2 services of these advisory services, and then I will explain as well the process that we're following, because we have already started these first 3 services. So I will give you more information on that later on. So the first service is strategy planning. The idea of the first 3 services is to target organizations that have no experience or very low experience on public procurement of innovation and co-creation. So the first one is about how to create a strategy for the organization. Next slide. For these first services, we were looking for up to 8 participants to be selected for conducting this service. So far, we have 2 participants in this service. And basically, the content is to help the practitioners of the organization to identify the areas and the objectives that are more suited for the organization to provide value for their doctors, for the medical staff, for the patients, and so on. What will you learn in this service if you apply for it is basically to transform organizational needs into some strategic goals, something that is tangible and is achievable. Also to align the priority needs of your organization with, let's say, the more procurement-oriented aspect of the innovation, so you can transform these needs into something that you can procure through procurement. And also to acquire knowledge and knowledge of legal and regulatory frameworks, and to develop an organizational strategy planning for innovation within your organization. Next slide, please. In this second one, the needs identification, the idea is to do 2 things with the participants. The first one is to help them to learn how to identify the needs within their organization, but also to prioritize these needs so they can focus on those ones that are more important and that can provide more value for the organization. Next slide. For this service, right now we have also 2 participants, and it's open to up to 6 participants. And as I was saying, the main goal is to identify the specific needs that each organization may have regarding the innovation, so they can transform these challenges into something that is solvable by the market, by providers, and by other entities. The idea is to help you to learn to recognize these unmet needs through a process of communication within your organization and conducting a campaign that will help you to create a debate and a discussion within your organization between the different units, so you have the most up-to-date information on what are the needs, where you can put more resources, how can you improve the cost efficiency, and how can you benefit from innovation. Once you have all this information in the hands of the decision makers, you will be able to prioritize and to understand how you can go for a certain pathway so you can get this value. So you will, as I was saying, you will learn to recognize these unmet needs and transform them into improvement opportunities. You will prioritize the needs to achieve better outcomes, and you will become familiar with methodologies to evaluate performance and create solid KPIs to assess which one of the different needs is more relevant for your organization. Next slide. And in the last service that we are offering, the open market consultation, the idea is to, once you have done these 2 first processes, the strategic planning and the identification of needs, to be able to communicate these needs to the market in a way that they can provide some solution for them, and how to work with the market and check against the market the different challenges and the state of the art of the solutions that you will be looking for, and so on. Next slide. For these services, we are trying to involve up to 4 participants, and basically what they will do is that they will be given some methodologies and materials, so they will learn how to reach the market in this sense. So they will be able to contact with potential suppliers and stakeholders to gather insights and feedback on the solutions and the innovation they are going through. They will use different tools such as surveys and market research, so the beneficiaries will be able to collect a lot of information on emerging technologies, state-of-the-art solutions, business models, and so on. What is in it for you? You will be able to use different approaches to validate the needs that you have identified against the market. You will be able also to identify market opportunities and barriers. You will become familiar with the most relevant players in the field, and you will be able to conduct a market consultation to fine-tune the organizational needs and address them. And in the next slide, I wanted to show you, we are right now starting this process for those 3 services. Next week, we will hold the kickoff meeting, which is the appointment of the advisors for each one of the groups that are participating in the advisory services. These sessions will be recorded, so if you join later on, and if you want to apply and you join later on, you will be starting, depending on the time you are starting, on one of the following steps, but the first ones will be recorded, so you will be able to check them and to consult any information that you need from there. And that's it from my side. If there is any question or...
Yeah, okay. Thank you, Lisa. Thank you very much. So just to summarize a bit, you have the 2 open calls right now available. So you have for the initial steps of the innovation procurement process that just Ulises explained to you. It's starting the service, but as he was mentioning, it's just in the initial steps. So the joint session will be recorded and available for the ones that join a bit later in the service. So it's not a problem. You can apply yet for this call. And also, you have opened the call for tranche 2 for the most medium to high level organizations until the 30th of May. So we invite you to participate and to sign up in the following days. And I insist on, if you have any question or you need any support in both of the calls, or you have any doubt, you can contact us through the email that you have available in the website, in the link we showed at the beginning, so it's not a problem. And I think in the chat there's no questions. Yes, okay. So we can read the question if you want and reply. Yeah.
Well, they're asking for if the legal compliance aspects of the tender document preparation workstream will or could this include compliance with the UK Procurement Act of 2023, or will be limited to the PCR 2015 compliance?
Okay, I will stop sharing because I cannot see the chat, so I will go. Just give me a second. Okay. Okay, give me a second. I check the question. Or would it be limited? Okay, it's a bit detailed question. If you want, Adam, we can address this by email. If you agree, you can write to our email and we will reply the question because it's a very specific one. So what we are addressing in this service about tender documents, it's just to give you some support and tips in the drafting of this tender, and of course the compliance with the legal aspects, but we will have to review this in a bit more detail. So if you agree, if you can send us an email and we will reply to you personally about this, because it's a very specific question. Perfect, thank you. I see there's another question also in the chat regarding the tranche 1 until 1 it remains open. So Ulises, if you want to go ahead, or okay.
Yeah, well, basically we are keeping both of them open until the same time. So this one right now is open until the end of the month, but in case that we decide to postpone the deadline, this one will be also be postponed, so that it will remain open until later on.
Yeah, I think here the key message is you still have time, but we think it's better to apply not very late, because we, as Ulises explained, that the service has already started, so it's better to join us as early as possible in this case, and to have more time for you also, because as I was mentioning, although the service is it's personalized and we can adapt to your needs, but we have a limited time within the project framework, so we don't want to delay and then rush at the end. So we invite you to register as soon as possible to start the services when it's more convenient for you also, and also having in mind that summer is approaching, so we don't want to get into summer and having to rush before or after. So yeah, that's I think the summary about both goals. Any other question? As I was mentioning before, the presentation and the recording will be available in the website, so you can check all the information, and of course you can write us through our email, so we can give you support whatever you need or doubts you have. Okay, so thank you very much for participating today, and hoping you register for the services, and see you very soon in the advisory services. Thank you.
Thank you.
Bye.
Thank you very much. Bye bye.